for a probable cause hearing. An initial determination was issued on December the 13th of 2023, finding that there was no probable cause to believe that the respondent, Advocate Aurora, violated the Healthcare Worker Protection Act, um, and by taking disciplinary action against the complainant because the complainant in good faith reported or is believed to have reported any information under section 146.997 sub 2 sub a Wisconsin statutes. The parties have turned in their exhibits as well as their witness lists, and I think that's pretty much it. She appealed her finding of no probable cause timely, and this matter is calendared for 2 days using video conferencing. And we are using Teams because we no longer use WebEx. All right, so everybody gets to stay. And Mr. Nelson, my understanding prior to going on the record is you're going to be the first witness. So if you raise your right hand, sir. Do you affirm or swear that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
You may lower your hand. Attorney Olson.
Thank you. First of all, can you hear me?
Yes.
All right, very good. Mr. Nelson, what is your highest level of education?
Bachelor's degree.
In what area of study?
Nursing.
And you have any licensure other than a license to drive a car?
I also have my EMT basic license.
Where are you employed?
Yes. Where?
Yes, sir.
Aurora Healthcare. Advocate Aurora in Burlington.
How long have you worked for Aurora?
I have worked for Aurora since April of 2006.
What is your current job title?
Patient care manager of the emergency department.
How long have you held that role?
Since August of 2022.
How many direct reports do you have in your role currently?
Currently about 38.
And is that approximately the number of direct reports you had during 2023?
Correct.
And the job that you have now, is that essentially the same as what you had in 2023?
Correct.
And who's your direct boss?
Currently, it's Andrea Anderson.
Andrea Anderson. And how long has Andrea Anderson been your boss?
About 4 months now.
Who was your boss before that?
So before that, we had an interim overseeing the director of nursing position, and that was Dawn Greason.
And Dawn was your boss as an interim during what time period?
From the time that I started here at Burlington, so August of 2022 until about 4 months ago.
And could you describe in a sentence or two basically what your job entails?
So my job entails kind of overseeing the daily operations of the ER, scheduling, ordering supplies, making sure that the patients are well taken care of, working with the physician group to make sure that there's good teamwork between the RNs and the physicians for smooth operations.
Do you know Kathy Duchow Cross?
I do.
And how do you know her?
Former employee here at Aurora.
Did she report to you at some point?
So I was overseeing her within the hospital, yes.
And you're distinguishing when you oversaw her, what is the distinction? Did she have dual roles?
So working for the forensic team, I didn't directly oversee the group of the forensic nurses, but Kathy had to report to someone within the facility. So I would have been that person because she did operate within the ER.
She did or she did not?
She did operate within the ER. So because I'm the manager of the ER, she reported to me while she was here.
And she did that in her capacity as a forensic nurse?
Correct. And as like the F&E coordinator, the forensic nurse examiner coordinator.
So did you understand that she had two roles? One is
Correct.
a program coordinator. So let's identify those on the record as clearly as we can. Is it accurate to state that she had one role that was administrative in nature as a program coordinator?
Correct.
And then did she have a secondary role that was clinical in nature as a forensic nurse?
Yes.
Okay. And the term SANE, do you know what that is?
Yes.
What do you know what it stands for?
A SANE nurse is a sexual assault nurse examiner.
All right. And is that the clinical function of what Ms. Duchow Cross did for Aurora?
Yes.
And how did your job interact with hers with respect to the SANE work or the forensic nurse work?
So pretty much whatever, if she needed something within the ED, I would be the one that would be able to provide that for her. If any, like equipment wise or if there was any issues with the patient, those would all kind of be forwarded over to me.
And how often did you interact with Ms. Duchow Cross in the respective course of your roles?
Probably daily. We had offices right across the hallway from each other.
And did you have any responsibility over her role as the coordinator in that administrative type work?
No, not really.
In your experience with Ms. Duchow Cross, did you find her to be hardworking
Yes.
and honest and competent in her job?
Yes.
Did her coordinator job involve connecting Aurora with community resources?
Yes.
And could you describe what that meant?
So she would work with different resources within the community. So like police departments, fire departments. She did a lot of networking with different, so like our crisis center or any like a women and children's type of horizons. She did a lot of those connections to make sure that if women were coming in who were sexually assaulted, they had the resources that they needed when they were to leave our facility.
Do you know how many different facilities Ms. Duchow Cross was to do forensic work at through Aurora?
Two for sure. It was between Burlington and Lakeland, but I believe she did help out at Kenosha once their coordinator was gone, or if they had holes in the schedule and stuff, we would always try to help cross over.
Was there a point when you had told her not to fill in at Kenosha and Mount Pleasant?
No, I do not believe so.
So your understanding is that she would be performing forensic nurse work at 4 Aurora facilities?
Or that, yes, they would like send they could have their patients come over to Burlington and then we would see them here.
And the sexual type, I'll use the term sexual cases that she was called to work on as a forensic nurse, would those come in at all hours of the day and night?
Correct.
And the do you know what the mileage span is between the 4 facilities that she was working at?
Oh God, no, not off the top of my head.
Okay. Were you at a discipline meeting involving Ms. Duchow-Cross?
I was.
And how many meetings were you at regarding discipline of Ms. Duchow-Cross?
2.
When were those?
It would have been the level 3 corrective action and then the termination. I'm not exactly sure on the dates.
Did the level 3 discipline involve more than one meeting?
I don't believe so. Not that I was a part of, no.
Did you issue discipline for the level 3?
I did.
Who asked you to issue the discipline?
Shireen Anderson.
And what was Shireen Anderson's relationship to you at that time?
Me and Shireen really don't have a professional relationship. She oversaw the same program as a whole.
When did Shireen Anderson ask you to issue the level 3 discipline against Ms. Duchow-Cross?
I don't know the exact date. It would have been the day that I submitted it.
Did you have an opportunity to object to that discipline?
No.
Did you have a problem with that discipline?
I had a slight problem just because, again, I only get one side of the story, but Kathy said that she requested multiple times for a policy referring to what the discipline was for, and she did not receive it. So
Did you ever receive the policy?
I did not know.
What is a level 1 and a level 2 discipline, if you know?
A level 1 would just be like an initial write-up. A level 2 would be a follow-up to the initial.
And do you believe it was improper in the case of Ms. Duchow-Cross to skip the first 2 steps of discipline?
With as many, so I'll say as many things that were written up, I don't think it was unnecessary. There was multiple actions of Ms. Duchow-Cross that were listed in there. I would say maybe about 10 or so. And if all of those were discussed prior to the write-up, I don't think a level 3 would have been improper.
Were those items discussed with Ms. Duchow-Cross prior to the level 3 write-up?
That's what I was told, yes. They were discussed at multiple meetings and meetings with Shireen and Ms. Duchow.
Did Ms. Duchow-Cross tell you they were discussed previously?
Yes, I believe they had meetings with Shireen and Dawn.
Did you tell Ms. Duchow-Cross that you had been instructed to basically copy and paste your words, what Shireen Anderson provided to you, and put that into a level 3 discipline?
Yes.
And did you tell Ms. Duchow-Cross you just did what you were told by Shireen Anderson in regard to the discipline?
Yes.
And did you tell Ms. Duchow-Cross that the discipline was not valid, to use your term?
No, I don't believe so.
Did you agree with Ms. Duchow-Cross that the discipline was not valid?
I told her that I would appeal it if I were her and go through the appeal process. There's a process that Aurora offers if you don't agree with a write-up.
Do you remember telling her on April 6, 2023, that the discipline was not valid?
I don't recall.
And everything that you told Ms. Duchow-Cross in your discussions with her, you were being honest. Yes?
Yeah, I believe so.
You not only told her to challenge the discipline, you told her that she should sue Aurora, correct?
I do not believe I said sue.
You didn't tell her she should bring a lawsuit against Aurora?
I don't believe that I used those words, but I did tell her that I would seek legal if she had those concerns.
Did you tell her that she should bring a legal action against Aurora?
I don't recall saying those exact words.
Words to that effect?
Yes, words to that effect, as in she should seek legal counsel.
And you wouldn't tell her to bring a legal action against Aurora unless you thought that Aurora had done something illegal, correct?
I guess you could say that, yes.
And you told Ms. Duchow-Cross that you'd be willing to speak on her behalf if she did file an internal grievance, true?
Correct. And I believe I did.
And did you tell Ms. Duchow-Cross that she was being set up by management?
I don't recall saying set up, no.
Did you describe in your conversations with Ms. Duchow-Cross that Shireen Anderson was being cutthroat, to use your term?
I don't believe I said those words. I don't recall.
Do you believe that Ms. Shireen Anderson was being cutthroat in her treatment of Ms. Duchow-Cross?
I do not believe so. Once we actually got into more meetings and I heard the reasons why, no, I don't believe so.
So even after you were in the meetings and you heard everything, you don't think you referred to Shireen Anderson as being cutthroat?
I don't recall using those words, no. Again, I only heard one side of it, so at the beginning when Kathy said that she wasn't receiving a policy or a procedure, yes, I was upset for Kathy's behalf.
Well, that's not actually correct, is it? Didn't you hear both sides in the discipline meetings?
In the discipline meeting, yes, but prior to
Okay.
that, when me and Kathy would discuss the situation, she told me that she's asked multiple times for a policy and procedure and told me that she never received one.
Right. And you understand that to be correct. She never got a policy, right?
Correct, but I believe that Shireen and Dawn had multiple meetings with her throughout this time that I didn't really know about, and they discussed what their expectations were.
Did you ever see any documentation of those meetings?
No,
And are those meetings normally recorded?
no,
You're aware that Ms. Duchow-Cross had asked for documentation of those claims that there were prior discussions, correct?
I wouldn't know. No, she could have.
You know that there is no written policy on when a SANE nurse starts to be paid when they're contacted to work on a case, correct?
Yes, I do not know.
Well, you do know that there is no written policy, right?
I don't know if there is or if there isn't. I don't oversee the SANE program.
Well, you sat in on the meetings and you heard Ms. Duchow-Cross ask for the policy, and you also heard Anderson say there is no policy, right?
I was not in on those meetings. The only meetings I sat in with Shireen and Dawn were for the corrective actions.
You'd agree that, or you agreed with Ms. Duchow-Cross in your conversations with her that she should be paid as soon as the call comes in to do forensic nurse work, correct?
If she's on the phone and working actively on a case, correct.
And did you understand that when she gets a call to do forensic nurse work, she is, during the travel to the facility, on the phone working with other individuals to coordinate that?
If that is her process, I'm not sure exactly what her process would be from the time that she receives a call.
So in your role in dealing with providing any information or resources that the forensic nurse needs, were there times when she would be talking to you on the phone after the call came in, making coordination with the patient?
No, I was never contacted when we had calls.
And you don't know who she would be communicating with?
No, I could guess, but again, that would be a guess of who she would be contacting just because of my experience as an ER nurse.
Ms. Duchow-Cross told you that she would not be doing on-call hours anymore for her coordinator role, correct?
No, I do not recall that. I think she wanted to decrease her hours, but she never said that she wouldn't take any hours.
Did you ever tell her that or agree with her that she had done that in any of your meetings with her?
I
By
don't
that, I
believe
mean
so.
that she had, did you have a conversation with her in any of your meetings that she would not take on call for her coordinator role?
No. Well, coordinators don't have on-call. So the on-call
not-
role would be her outside clinical part, not the coordinator part.
So the coordinator role, the job description does not require on-call.
That's a salaried 40-hour-a-week position.
Was there a time period when Ms. Duchow-Cross was on call?
Yes, she would be on call like after her normal salaried position because that was her dual role.
And in her dual role as a forensic nurse, you had conversation with Ms. Duchow-Cross about her not working on call in that capacity, true?
Not that she would not be on call at all. I know that she discussed decreasing her hours on call, but I don't recall a conversation of her saying that she didn't want to do it at all anymore.
You understood that she needed to decrease her hours because she physically could not handle it anymore, true?
I don't know what her mentality would be. I know that she wanted to decrease it because it was just a lot of hours. I don't know if she couldn't handle. I felt like she was handling it, but she's a very hard worker.
So your testimony is you never told her that, or you never had conversation with her that she physically couldn't handle the hours anymore.
I don't believe so. Because otherwise we would have just had to remove that dual role altogether, and she never dropped that dual role.
Well, there are other individuals who were also responsible for providing the forensic nurse services, correct?
Correct. She had a couple people in orientation and was trying to get them off the orientation schedule so they could be on their own.
Okay, and you were aware of a claim that she had mishandled a taking of photographs,
I am, yes.
and you had told Ms. Duchow-Cross that there was no HIPAA violation in what she had done, correct?
Correct. I didn't believe there was because I didn't fully understand the process of what they were supposed to do.
Well, you were present during the meetings when the employer, the management, went through excruciating detail about what they claimed happened, and Ms. Cross responded in tremendous detail about what happened, right?
I don't recall being in that meeting. I just recall knowing about this at the termination meeting. I know more of it because Kathy came and talked to me in my office about it.
So
But
you
I
don't recall.
don't recall being in a meeting where they discussed the interaction. I might have been.
So that you were, though, at the level 3 discipline, you cut and pasted that document together, and it went. Shireen Anderson went through that with her. True.
Yes, that would have been like the timekeeping one, I believe.
Well, wasn't the camera discussed during that as well?
I don't believe so. I think that was at the termination meeting. I think the level 3 was just around the timekeeping and the confusion that she had between the coordinator role and the on-call role.
Did you have an understanding that there was a difference in the way the on-call procedure was handled between Illinois and Wisconsin?
I did not know that, no.
Did you refer to the allegation about her handling of the photographs as ridiculous?
Yes, because I didn't know exactly how they were supposed to go or what actually happened. I wasn't part of the investigation with that at all.
That's based on your testimony that you don't recall that being discussed in the level 3 meeting, right?
I don't believe so.
Did the DA ever raise a concern about the handling of the photographs?
Not directly to me, no.
Were you present on April 6th when Ms. Duchow Cross stated specifically that she was not going to handle call?
I don't believe so.
That's all I have for you.
Attorney Kaiser?
I just need a minute to organize my notes here. Good morning, Mr. Nelson.
Good morning.
Could you tell us, do you know the name of the department that Ms. Duchow Cross belonged to?
So it's the SANE or FNE program, so the Forensic Nurse Examiner or SANE program.
And I'm just trying to understand the hierarchy or the organizational structure a little bit better here. So what is your relationship to that organization in your role as a patient care manager of an ED?
So I just oversee their interaction of them within the department. So if a lot of the SANE nurses come in, they use one of our emergency rooms in the ER. And if there is any issues with the interaction with the patient or the physician, I would then be able to work with them.
What facility are you located at?
I'm at Burlington.
You mentioned that Ms. Duchow Cross split her time between a couple different facilities. How much time was she spending at Burlington where you were located?
So her office was here, so she would at least do her 40 hours of the coordinator role here at Burlington.
Okay. So her primary job, the salaried 40 hours a week job, that's at Burlington. Is she
Correct.
also doing the forensic nurse examiner role at Burlington, her secondary role?
Yes, that would have been split between like Burlington, Lakeland.
Thank you. All right. So you had mentioned that, I don't know the exact wording you used, but you had mentioned that you were her manager. Could you explain that relationship? First,
So,
your relationship to Ms. Duchow Cross.
so because Shireen oversees the whole program, but Shireen is not at Burlington, I was Kathy's manager as she needed to report to someone in the coordinator role here at the facility.
Understood.
So I would have been her direct manager for reporting purposes, but I did not oversee the same program.
Okay. So what sort of gaps would there be in your management or supervision of Ms. Duchow Cross, being that you are not in the sexual assault department? Does that make sense?
Yes, I believe like the whole thing is a gap because I don't know exactly what they do. I don't know the process of their work. I don't know really anything about the program other than they take care of sexual assault patients here in the ED or domestic abuse children or drug endangered children, stuff like that. They do a lot of different roles within the program, but I wouldn't be able to speak to anything that they do personally.
In your role, did you have vision into approximately how many patients per year Ms. Duchow Cross was treating?
I would say probably approximately about 35 a year ish.
Was that consistent during the period of time in which you overlapped with Ms. Duchow Cross at 2022 when you became the patient care manager of the ED?
I believe so. Again, I started like towards the end of 2022, but yes, I believe that it would be on track for about the same amount.
In that period of time, did you ever observe Ms. Duchow Cross do anything that ever went beyond your understanding of her responsibilities as a sexual assault nurse examiner coordinator or as a forensic nurse examiner, her secondary on-call role?
Objection, no foundation. He's already testified that he doesn't know what her role was or her duties.
I was going to say it's more compound. I'm going to just ask you if you could rephrase it because it was
Sure.
a lot of stuff in that one question.
Sure. Are you Mr. Nelson, do you understand what Ms. Duchow Cross's SANE coordinator role was, her primary role?
To take care of, the SANE coordinator was to oversee the program between the two hospitals. And if patients checked in during her normal office hours, she would be willing to see them and do an exam on them, a sexual assault nurse exam.
What was your understanding of her secondary role as a forensic nurse examiner, the on-call role?
So the on-call role it's the same thing. She would still do an assessment of these patients. It would just be more after hours, nights, weekends, stuff like that, whenever she would take call time.
Do you ever observe Ms. Duchow Cross ever do anything that went beyond her responsibilities in those two roles?
Object, no foundation. It's still compound.
I'm going to overrule that. Go ahead. You can answer that question.
Kathy was always willing to help out. So if the ED nurses called her for anything, even if it wasn't for an exact sexual assault case, she would be willing to come in or help them figure out, like if a patient had issues getting home, if they had transportation issues, she would try to help them the best she could because she's a nurse. She always wants to do the best for the patient. So, it wasn't always just about sexual assault. She would do whatever she could for them.
Did Ms. Duchow Cross have any role at the facility that didn't involve sexual assault nursing? For instance, any regular nursing type job?
No, I don't believe so.
Were you ever aware that Ms. Duchow Cross had another job outside of Aurora?
Yes.
What was your understanding of her other job?
I believe she did psych NP, so like a nurse practitioner for like an outside community resource type thing with psychiatric patients.
Was Aurora the employer?
No, I do not believe so.
Do you know how often Ms. Duchow Cross worked at that outside job?
She had office hours, so I know for sure 1 day a week. I'm not sure if there was any more than that.
Do you recall which day of the week?
I believe it was Tuesdays.
What was your understanding of the time commitment on at least on Tuesdays for her outside job?
I do not know. I believe it was just a normal office hour, so maybe a 9 to 5.
Mr. Nelson, did Ms. Duchow Cross ever report or complain to you that the number of hours she was working, whether that was at Aurora or her outside job, individually or combined, that the number of hours was putting the health or safety of her patients at risk?
No, I do not believe so.
To your knowledge, did Ms. Duchow Cross ever do anything to put the health or safety of a patient at risk?
No, I do not believe so.
Did you know that Ms. Duchow Cross was recording her conversations with you?
No,
Did she ever ask for your consent to record those conversations?
no.
How does it make you feel that she was recording private conversations with you?
Object relevance.
I'm going to let him answer.
Pretty awful.
As you got ready for today's hearing, did you happen to listen to the recordings of the meetings that you were in that Ms. Duchow Cross has produced during the case?
Yes, there was quite a bit. It was time consuming.
About how much time do you remember, or how long were the recordings that you listened to, if you had a guess or a estimate?
I'd say it was about 20 minutes per recording, and there was probably over 10 recordings.
In any of those recordings, did you ever hear Ms. Duchow Cross say anything about the number of hours she was working and how it was allegedly impacting patient health or safety?
I believe there was a conversation came up about the hours, but not that it was impacting health and safety of the patients.
Did you have any role in the investigation of Ms. Duchow Cross's timekeeping and pay practices that started in January of 2023?
No, that was handled between Shireen and the interim director of nursing, Dawn.
Okay. Can you explain, like, so you are her manager, right? Then you don't have any involvement into this investigation that led to a corrective action level 3. Can you explain why is it that you are not involved in that type of investigation in this case?
I believe because Shireen oversees the whole SANE department as the umbrella. And so her and Dawn, Dawn, prior to my arrival, was already working with Kathy on the bonus shifts and trying to get her pay corrected, and she was opening the HR cases herself. So when I came in as the manager, since they were already in process, they just kept handling it. Instead of adding me to the mix, it was just easier for them to continue on the path.
Have you ever had any responsibility for the timekeeping and pay practices for SANES?
No.
And to your knowledge, who is responsible for those types of things?
To my knowledge, it would have been the coordinator. So like Kathy would oversee all of the SANE nurses that worked between the two. And then Shireen or whoever would oversee Kathy as the coordinator.
Did you have any role in the decision to issue Ms. Duchow Cross the level 3 corrective action following that investigation?
No.
To your knowledge, who was responsible for the decision to issue her the corrective action level 3?
Miss Anderson.
Okay. And why is it that you ultimately were the one who issued the corrective action, even if it wasn't your decision?
Because Shireen wouldn't have access to her in our computer system, so we use Workday. And since I was her overseeing manager, because she worked within Burlington, I had access to her Workday, so I would have to submit it electronically as a level 3 in Workday.
Have you ever been, in your role, responsible for disciplining any team members for time theft?
No.
Are you familiar with HIPAA?
Yes.
Does Aurora have HIPAA-related policies for team members?
Yes.
During your employment with Aurora, have you received training on HIPAA?
Yes. We do an annual, once a year, mandatory HIPAA training.
I was just going to say, just generally, can you give us a sense of, tell us what are those HIPAA-related policies that Aurora has? I don't need you to, read me them or anything like that, but generally, what's the general nature of those?
So generally just not giving out any patient identification, no patient information without the consent of the patient.
Did you have any role in the investigation of a HIPAA concern related to Ms. Duchow-Cross's use of a law enforcement officer's iPad camera?
No.
Did you know about that issue when it occurred?
I don't know if it was right when it occurred, but yes, Kathy kind of discussed with me and told me what had happened or what was being said, what was brought forward to her, yes.
And when did you first find out that there was potentially a HIPAA concern involved?
I believe Shireen contacted me at some point when we were working on doing the termination process.
Did you have any role in the decision to terminate Ms. Duchow-Cross's employment?
No.
To your knowledge, who was responsible for that decision?
Miss Anderson?
And what did Ms. Anderson tell you about the termination decision?
That photographs were taken of a patient with their consent. The photographs were taken, but then the photographs were given to the police department on an iPad that was borrowed from the police department. And I don't believe there was any consent from the patient that the photographs could leave the facility.
And did you have an opinion on whether what Ms. Anderson was telling you Ms. Duchow-Cross did, whether that was a HIPAA violation and violated Aurora's HIPAA-related policies?
No, I didn't have any opinion.
Did you have an opinion about the decision to terminate Ms. Duchow-Cross's employment based upon that HIPAA violation?
I mean, if it's a very black and white situation when it comes to HIPAA. So if you violated HIPAA, it usually leads to direct termination.
Are you aware of other team members who have been terminated for similar HIPAA violations?
Yes, absolutely.
I don't have any further questions. Thank you, Mr. Nelson.
Thanks.
Any redirect, Attorney Olson?
Mr. Nelson, you are aware that there was a court order for those photos by a forensic nurse, correct?
I'm not aware of that, no.
You're aware that when there's a court order that the police can secure those photos and use those photos in their case with the DA, correct?
I am not aware. I did not think that it happened day of. I thought they would have to subpoena for those photos.
So you think a subpoena would be necessary instead of a court order? A court order doesn't carry any authority in your view, right?
I don't know the process, so I can't answer that, no.
Very good. And Ms. Duchow-Cross told you repeatedly that she thought she was being discriminated against and retaliated against, correct?
Correct.
That's all I have. Thank you.
Okay. All right. Thank you, Mr. Nelson. I did not get your email, but I'm going to assume, and maybe I shouldn't, that it's going to be the same thing, first name dot last name at aah.org.
Correct, but it's Steven with an N,
Okay.
not just
All
Steve.
right. Okay. All right. Thank you. If there's nothing further, then thank you. All right. Your next witness.
Do you have Chanel Vandenberk in the holding cell?
Steve,
Holding
Steve, you can take off too.
Okay, I was like,
Yeah.
do I go?
Yeah, you can go. Thank you, Mr. Nelson.
Thank you.
Thank
All right, let's see who we have out here. And I've got something going on with my keyboard. There's nobody in the waiting. So
Okay.
would you like to?
I will make a call,
All right.
and I had her slated for 10:30. Looks like it's 10:22.
Well, it's 10:22. Do we want to take a short little break till 10:30, and that'll give you a chance to get her?
Okay, sure.
All right. Why don't we do that? Okay.
Okay.
Thank you.
Very good. Thank you.
Like it just didn't happen. So good thing you wrote down your questions. Okay, we are back on the record after a short break. Appearances are the same. We have Attorney Olson on behalf of his client, Miss Kathy Duchow-Cross. Also have Attorney Kaiser, as well as co-counsel or in-house counsel. We have Attorney Bridget Mesfeld, respondents. Representative is also still here. That's Miss Shireen Anderson. And we have an observer on behalf of the law firm that is here. I'm sorry, what?
On behalf of Aurora, not
On
not
behalf
law
of
firm.
Aurora, and that would be Miss Marley Reichel. And we just are getting ready to start with complainant's second witness, and that would be Miss Chanel Vandenberk. If you could raise your right hand, please. Do you affirm or swear testimony you're about to give will be the truth, the whole truth, and nothing but the truth? Oh, you're muted.
I do, yes, thank you.
Okay, you may lower your hand. Attorney Olson, could you repeat what you just did?
Sure. Ms. Vandenberk, what is your educational background?
I have a bachelor's of science in foreign service from Georgetown University. I have my Juris Doctorate from the university, from Loyola University Chicago, and I also have my associate's in nursing degree from Lake County Community College, or CLC.
During what time period did you work at Aurora?
From May 2013 to early January 2024.
And in what state were you working for Aurora?
Illinois.
What was your last position with Aurora?
I was the sexual assault nurse examiner manager of the Northern Region for Advocate, which covered the hospitals located in Libertyville, which was Advocate Condell, Barrington, Illinois, which was Good Shepherd Hospital, and then Elgin, Illinois, which was Sherman Hospital. So I was in charge of the sexual assault treatment programs for those three hospitals, which was considered the Northern Region for Illinois.
How many direct reports did you have?
It varied anywhere between 6 to 15.
And I'm assuming those were forensic nurses.
Correct. Yes.
And to whom did you report in your job last?
The last, prior to the most recent report was Belinda Boyle, who was the forensic nursing director for Illinois and Wisconsin.
Were there regularly scheduled meetings when the forensic nurses would report their activities?
Yes, there were.
How often were those meetings?
I would say monthly.
Were there meetings when the forensic nurses from Wisconsin were also involved?
Yes, I believe those were at every meeting. It was both Illinois and Wisconsin.
And in those meetings, what would the forensic nurses be reporting on?
Generally speaking, it would be consistent across the board. Every month we would discuss patient care issues, and then administration issues, staffing, as well as policies, procedures, and goals for the future.
Did the topic during 2023, did the topic of when a forensic nurse was to start logging their time come up?
Yes.
And can you describe the context of that?
Basically, there was a discussion of how that was to occur and when it was to occur, like what situations, and generally speaking, the process as far as when we were supposed to clock in, when we were supposed to clock out, different coding and that sort of thing.
Was the practice in Illinois different or the same as it was in Wisconsin regarding when the forensic nurse would start logging their time when they were called to work on a case?
It was different. My understanding is we have also had a different clocking system to capture when we clocked in and when we clocked out, as well as timekeeping.
And what was the difference between Illinois and Wisconsin?
I believe it was the expectation of when we were supposed to clock in, when the time was counted, whether travel time was captured or not.
And from those meetings, what was the practice in Wisconsin? And if you could distinguish that from the practice in Illinois?
To the best of my understanding, because again, for Illinois, the process is we would get called when a patient arrived in the ER. The ER had staff that was present, so they would start the whole process of triaging the patient, indicating that a SANE was on their way, and then they would just basically wait. But other types of care would be provided, like a medical screening to make sure that they were doing okay. But other than that, there was always someone there. So a SANE would clock in once they arrived in the emergency department. And that's because we would have zero communication with the patient, and also we would not communicate with the charge nurse. So basically, I wasn't offering any type of patient care. I basically didn't exist yet until I physically got there. And then my understanding from the meetings was that the practice might be a little different and that care could possibly start from the minute that that forensic nurse was contacted.
So just to interrupt for a moment, when you say different, are you now talking about Wisconsin?
Yes, yes.
Okay. And you said that the care may start earlier. What did you mean by that?
That the communication as far as the what kind of care would be given, how to interact with the patient, and sort of a communication with that patient, planning, sort of a care, if you will, like a care plan being implemented, whereas that would not be the case from the Illinois side.
And did you have an understanding from the meetings that the forensic nurse would start logging their time from when they got the call and started working on the case, even if that preceded the time that they arrived at the ER?
Yes, that was my understanding based on those meetings.
And during the meetings, was there ever a request to see a written policy as to how the work was to be logged, or when that would start?
There were requests for written policies based on pay practices and the ability to provide incentives for staffing, and how those funds were to be categorized or accessed, especially during times when staffing was very low. So there was questions about how to apply. For example, there were critical care funds that were set aside. So when I was reporting to my direct report, there was questions about if that's something on the Illinois side we could access the same way, or if that was different. So we really wanted to make sure that we saw that a policy or some sort of statement about that. Again, especially because we're working with two different states, we wanted clarity in the form of a written policy.
Were there any requests for policies as it would relate to the proper time at which a forensic nurse would start logging their time when they were called out to do forensic nurse work?
Not that I recall.
Were there any policies that you're aware of in writing that described when it was appropriate to start logging time when a forensic nurse in Wisconsin was called out to do forensic nurse work?
Not that I'm aware of on the Wisconsin side.
Was there a policy in Illinois in writing?
I believe there was, yes.
Okay. All right, that's all I have for you.
Attorney Kaiser?
Just a few questions. Ms. Vandenberk, you left Aurora in January 2024,
That's correct.
quit about 3 months after Shireen Anderson promoted Belinda Boyle to be the director of the forensic nursing program.
I'm not sure about the timing of that.
Soon after,
I left in January.
and that was about 3 months after Belinda Boyle had been promoted to be the director.
I'm not honestly sure.
Prior to Belinda Boyle becoming the director of that program, there had never been a director. That role didn't exist prior to then.
Again, I'm not aware.
What was Belinda Boyle's role previously?
I believe she was a direct report to Shireen Anderson. So back when I attended those meetings that I discussed, my understanding was Shireen Anderson was in charge of all of that.
Did you have any awareness ever of the same patient volumes at Burlington and Lakeland hospitals in Wisconsin?
Not a specific number, no.
Do you have a sense of what the volumes were at those hospitals as compared to at the hospitals in Illinois where you were working?
I believe they were comparable because my understanding was that there were several regions that were being covered.
What do you mean?
know that there were the same higher volume. I understand that Kenosha was a high volume, Burlington was a high volume combined. But as far as direct access to the numbers, I wouldn't have that in my role and in
Okay.
my scope.
You never worked alongside Ms. Duchow Cross.
No, not alongside, no.
You don't have any knowledge of Shireen Anderson's reasons for issuing Ms. Duchow Cross a corrective action level 3 in March 2023.
I would not have direct access to that, no.
You don't have any knowledge of Shireen Anderson's reasons for terminating Ms. Duchow Cross's employment in May of 2023.
I would not have access to that, no.
To your knowledge, did Ms. Duchow Cross ever do anything to put the health or safety of a patient at risk?
Not at all. Not to my knowledge.
To your knowledge, did Ms. Duchow Cross ever report to or complain to Aurora that the number of hours she was working was putting the health or safety of her patients at risk?
I would not have access to that knowledge, no.
Thank you. That's the only questions I have.
Any redirect, Attorney Olson?
No, thank you.
Okay, I have one question just for clarification. Okay, we have Belinda Boyle. Is she above Miss Anderson? What is the hierarchy here? Can somebody just explain that to me for my own notes?
I can explain that. At that time, I was overseeing all of the forensic nursing programs in Wisconsin and Illinois as a vice president.
Okay.
I needed to put a director in so that there was more of a line of sight on the programs and what was happening around pay practices, on call, etc. So that's when I promoted Belinda Boyle from a manager role into a director role. So we essentially
Okay.
changed the structure of
Okay,
our,
so that's what it was. So we've got a middle level now, and then that Belinda Boyle also did both Illinois and Wisconsin.
yes, that's correct.
Okay, got it. That's all I needed. Okay, thank you so much for that clarification, because the names kept coming up, and I'm like, whew. Okay, all right. If there's no more questions for Ms. Vandenberk, thank you very much, ma'am. I appreciate it.
Thank you.
Thank you.
All right.
You're up next.
Okay, who do we have next?
The
Attorney Olson.
complainant, Ms. Duchow Cross, will testify.
Okay. All right. Hopefully we're not going to have any echoing here. Ms. Duchow Cross, if you could unmute, raise your right hand.
Would it be okay if we take a 5-minute restroom break before we get underway? I'm guessing this examination is going to be a little bit longer.
Oh, absolutely. I'm sorry. Yeah, please
It's
let
okay.
me know if people need to do that sort of thing, because I'll just keep on going. Sure. Why don't we do that? It's 10:52. Let's everybody be back by 11, okay?
Great, thanks.
All right. Thank you.
I have a question. Do I hit that one?
Just hold on a second.